The headaches affected my daily life tremendously. I couldn't plan anything without the threat of headaches. It affected my family, my concentration on my work, on my children, especially my children who were very young.
2 years ago, I was assaulted and hit in the head, and shortly afterward had headaches.
At the time, I was having headaches almost every day. Like, it was tough to do regular things. I had to withdraw from school.
The Lexington Headache Clinic offers a non-narcotic, multidisciplined approach to the treatment of headache. Together we can help.
I'm Dr. Jim Ney, and I started the Lexington Headache Clinic because I had a headache for 7 years.
Although you might not normally refer headache patients to a dentist, there are good reasons to send them to Dr. Jim Ney and our team at the Lexington Headache Clinic.
Prior to coming to the Lexington Headache Clinic, I received many different narcotics and medications for migraines. I had headaches almost every day from the time I woke up till about the time I went to sleep.
Although migraine is the most common headache diagnosis, the reality is that 85% are cervicogenic, or a manifestation of TMD.
I've had gone to different doctors and physical therapy and chiropractor and of course massage, and it's a good temporary relief, but it was not treating the actual cause.
If your patient describes their pain as steady or constant, they are likely suffering from cervicogenic or TMD type headaches. The Lexington Headache Clinic successfully manages patients' pain by dealing with the most common cause of headache: muscle.
I really don't even want to acknowledge it sometimes. I'm afraid it's not true, so it's nice not to have to wake up in the morning and have to go right back to bed and not be able to spend time with my family.
Our treatment is also successful for vascular type headaches or migraine when the patient is experiencing pulsatile pain.
I have had migraines for about 13 years. It was getting to the point where it was about 5 times a week. I was having trouble getting my schoolwork done and getting everything done that I needed to. I was excited when I came in that somebody wasn't just going to hand me more medicine and say, I'll see you in 4 to 6 months and we'll see how that worked.
As well as the treatment of neck and shoulder pain that a patient may not describe as headache at all.
I would encourage anybody that's suffering from neck and shoulder pain especially to check with the headache clinic, because I did not realize that the jaw pain and the head pain was all connected.
Dysfunction of cervical and TMJ muscles lead to myofascial pain and trigger points, which will eventually manifest as cervicogenic or TMD headache. The causes of TMD and cervicogenic headache are the same. It only makes sense that the treatment should be too. Treatment at the Lexington Headache Clinic typically consists of 4 main components. The first component we address is the fabrication of an oral splint. Chronic tension is held in the muscles of mastication if the mandibular condyles are not seated appropriately in the temporal fossa when the teeth are occluded. Over time, this leads to myofascial tension and the development of trigger points in muscles. With the fabrication of an oral splint, the patient will be able to simultaneously set the mandibular condyle and the temporal fossa while meshing the teeth, thus reducing muscle pain. There is a direct relationship between jaw position and tension within the cervical muscles. In this model, where rubber bands represent muscle, we see that a change in jaw position, where the mandibular condyles are not seated in the temporal fossa, can cause tension in the upper trapezius. In order to relieve the tension, we must correct the alignment. This is accomplished with a splint. The direct relationship between jaw position and tension in the cervical muscles is clearly illustrated by needle EMG. As we place an EMG needle into the upper trapezius muscle and have the patient clench their teeth, you will notice a significant increase in EMG activity of the upper trapezius, which demonstrates the relationship between masticatory muscles and cervicogenic headaches.
If we looked at just one factor, if we say looked at the way your teeth come together, this would be a very important but also a minor part of the total therapy needed. So we have to look at multi-factors from different directions and include different specialties in medicine to look at muscle-related headache.
The next component to be addressed is sleep. The Lexington Headache Clinic addresses patients' sleep problems with medication and health psychology.
Sleep disturbance often leads to headache onset. At least 50% of patients that have headaches, when they have sleep disturbance, it exacerbates their headaches.
The patient goes to bed tired and awakens tired. In other words, experiences non-restorative sleep.
I wasn't able to sleep. I didn't have time because basically I'd be going along with my daily life. I'd get a migraine and the rest of the day would be shot.
With minimal medication and health psychology, our treatment allows the patient to achieve restorative sleep.
I've had a lot more time because I'm not always getting the migraines, and I guess I never really realized what it would be like to live pain-free.
Headache pain is referred from trigger points in the cervical and TMJ muscles. The third component in the treatment is to restore normal muscle health and function. This is accomplished through medication, trigger point injections, physical therapy, and health psychology. If physical therapy is not successful in fully alleviating the myofascial restrictions, trigger point injections will be performed under EMG guidance. Botox injections are utilized in the most extreme of cases. Medication may be prescribed to modulate pain or inflammation, although our goal is to help patients manage their pain without the use of medicine. The final component of the Lexington Headache Clinic protocol is to restore normal cervical strength. We are all aware of the relationship between weakness and dysfunction, and headaches are no exception. We have found that the majority of our patients possess less than 30% of what is considered normal cervical strength. That weakness can lead to dysfunction of the cervical and TMJ muscles, resulting in myofascial pain and headaches.
The treatment did differ tremendously. I think most of my other treatment was mainly just more medication, targeted mainly for migraines. They didn't focus on the actual cause of my headaches, which was the weaker muscles.
Our physical therapists at the Lexington Headache Clinic have been trained in the use of a computerized cervical strengthening unit called the MCU. This unit is one of the very few in use throughout the state. Typically, our patients measure within normal ranges of cervical strength by the time they finish treatment. We feel this is key to a patient's long-term success in their management of headache. When you refer a patient to our team at the Lexington Headache Clinic, together we will make the right diagnosis, implement the appropriate treatment plan, avoid costly MRIs, trips to the emergency department, and dependency on narcotics.
And now I can visit with my friends after work, cook dinner, enjoy life.
I met Dr. Nay, and he was really enthused about treating me and gave me a lot of hope. I'm back in school, going full time. I mean, he changed my life.
It's worth any bit of time that you have to put into it to not have to worry about headaches anymore, to be able to get on with your life.
My daily life has improved so much because the pain is not there, and I've gained so much mobility in my neck that it's amazing.
Probably just a much happier person.
We are the Lexington Headache Clinic.
We're the Lexington Headache Clinic.
We're the Lexington Headache Clinic,
And together we can help.
My life is much better.